Let's gaze into the future for a moment, to a time when physicians will have at their disposal a diagnostic tool so powerful and so precise that it will provide them a roadmap, a pathway that will guide them through the maze of medication choices, and which will pinpoint the exact medications that will be effective for specific patients and specific conditions, and at the same time will show which of the patient's current medications that may be ineffective and in many cases harmful. That tool exists now and is being used by more and more doctors across the country all the time.
The way I look at it, essentially anyone who ever prescribes a drug in some way could be using pharmacogenomics to better dose the drug for good patient outcomes.
Physicians love it. Once they start testing, they realize that the importance of this is that now the drugs are doing what they're supposed to do. The patient loves it because the patient actually is prescribed the drug that is going to work for them, as well as the dosage is going to be right for them.
The genomics revolution is making dramatic contributions in many areas, but the aspect that has generated the most excitement and anticipation is in human health and medicine. Physicians and patients are increasingly excited about the medical genomics field and how it can enhance patient outcomes. The quest for more and better information to improve healthcare is the driving force behind this revolution.
Diseases and therapies are genetically predetermined, whether they occur or whether they are successful. So large randomized trials do not give the full answer of how certain therapies can affect an individual. That individual's response to that therapy is predetermined by their genetic makeup. So I think it is important that we understand that and understand the implications that may have in response to therapy.
Atrial fibrillation, which is in escalating numbers in this country, especially now we're projecting about 5 million patients in the next 10 years with atrial fibrillation, patients with deep venous thrombosis. So I can name so many situations where the implications for resistance, whether it's Plavix or Coumadin, are paramount. So it's very important to identify these patients.
And that's where natural molecular testing comes in. Testing done by natural molecular testing provides physicians with a state-of-the-art tool that gives them data to help them understand which medications and therapies are working, which are not, and which ones may actually be doing harm.
Almost every single drug you're on, we can tell you how they're going to interact with each other, what complication you're going to have, whether you're on the right dose. So finally, we're able to exactly predict whether you're going to get the outcome that we expect. If you look at what natural molecular tests, we test for about 5 pathways for drugs, and they cover about 80% of all prescribed drugs. There's another 20% that we don't test for, and the reason we don't test for is we actually test for the metabolic pathway through the liver.
The testing procedure is simple and can be administered by a nurse or clinician. A buccal swab sample from the patient's mouth is placed in an envelope at the doctor's office and is then sent to natural molecular testing labs. Lab technicians then extract the patient's DNA and process it through state-of-the-art genetic analyzers. Test results, along with interpretive information and dosing suggestions, are returned to doctors via their method of choice, secure server, fax, or EMR, in 2 to 5 days.
They have very quick turnaround times when you send genetic material. For instance, I'll see a patient in clinic, make a decision as to whether or not they need an intervention, and we'll swab their mouth to gather the genetic information, FedEx it off to the company. Within 3 days, when I'm about to start the procedure, the selective procedure on the patient, I will have that information that I can very quickly look up on my iPhone and know what medicines they should be treated with and what ones they would not do as well with.
When I started doing the molecular testing in the office, certainly we did have some pushback from the other physicians who thought it, had trouble understanding how this was going to impact their care. But once they saw a few cases, very illustrative cases of how this really impacted and changed a patient's care, they quickly bought onto it and then started doing the testing themselves and started seeing the same results. So it was very, very easy to get other people to understand this.
Genetic testing by natural molecular testing can have life-changing effects. Such was the case with Wayne Hitt's father, who was facing amputation of a leg and who was taking multiple medications.
My father, in the last several years, has had knee surgery, a total knee replacement, has had his ankle fused, and had 2 neck surgeries, and was on several different pain medicines and several different medications altogether, and was getting no pain relief and was about to the point where he couldn't get around anymore. We had him tested, and 4 of the 5 pathways that we checked for were abnormal. He was taking about 9 different medications, and so we got with him, Angela being the pharmacist, got with his doctor. They worked out a plan and changed about, like I say, half of his medicines, and 2 weeks later he was a totally different person. Able to get up, move around, walk around, and with minimal pain. And got pain relief for the first time in several years.
Well, I guess it brings it down to home when it's one of your family members. When we were there at Easter, he couldn't even get out of the chair. He never moved. He didn't even get up to eat. And, as Wayne said, now he's getting up, getting around, and
Going back to his normal self that he was 10 years ago. Just with that slight medication change.
Molecular testing is really going to be setting a trend of future medicine. We're going to be treating patients based on their genetic makeup, not only for medications just like Coumadin or clopidogrel or other medications, but also we are now going to be testing for patients who have had these abnormal rhythm issues that may be genetically predisposed for the patient. And not only that, but if a patient has these rhythm problems, we can then bring their family members in and have them screened. So therefore we can get a leg up on these patients before they have life-limiting issues. So I think it's very, very important as we embrace molecular testing that we really understand the true implications of how this is going to help patients in the future.
Because I think really medications are what change the outcomes more than anything else, especially if we can deliver them with that term surgical precision. And using genomics for the first time ever, we were able to exactly predict how a patient would respond to their drug, what dose he requires, what the side effects are going to be. And so I think this is going to be revolutionary in the next 5 years or so. And we would probably look back currently the way we deliver drugs and say, God, how primitive was that? Just to give someone a pill and hoping it works, not knowing whether it's the right drug for them, whether they're going to have any efficacy or any toxic effects.
Why wait? Why wait till a problem occurs when it can be prevented? An ounce of prevention, remember.
We are partnering with physicians as well as insurance companies to go out and make sure that every patient has a genetic roadmap to their health. Natural molecular testing is your partner for molecular. Natural molecular testing is going to be here to give you the information that you've always wanted. You dose drugs all the time, and you give a patient a drug, and the patient comes back and is not doing well on a drug, and you up, down, you continue to do these upscale, downscale delivery methods of the drug. By doing genetic testing with natural molecular, you are going to give the patient the right drug and the right dose and take the guesswork out of it. It's going to be simplified. It's zero impactful to your practice. It's zero impactful to the patient. It's nothing but a wealth of information that not just you as a cardiologist or a podiatrist or a psychiatrist, it's for all the physicians. They're all going to look at this test result and be able to help the patient live a healthier and better life.